What's going on, guys? My name is Aaron. I'm a senior IRR student here at Union College. Myself and 14 other students are preparing to go on their 3-month overseas expedition to Malawi, the African country of Malawi. We'll be working as certified medical assistants alongside their doctors, medical direction, and other healthcare providers in Malawi. Because it's a 3-month trip over, we have a lot to bring. One, because we'll be there for 3 months, and because we'll be working as medical providers and have that mission as well. So with that being said, there's a lot here. I'm going to kind of go over why I have it set up this way, what packs I've chosen, as well as my philosophy on the gear I've chosen. So without further ado, we'll go over my first pack. So both packs are from 511. And quick disclaimer, there's some things that aren't here that are in the packing list, and that's just because they're in my other pack. Or they're still in the mail coming. So anyway, we'll start with my first pack. This is the Rush 12 from 511. This is going to be my main medical pack. It's going to have everything from trauma supplies to my PPE to my diagnostic tools for my different clinical rotations. So before we go over that pack, we'll go over why it's attached and how it's attached to the Rush 100. So this big brown pack is the 511 Rush 100 pack. It's their main deployment style bag. It's 60 liters, has these little 3.5 liter side pouches for sustainment, and then allows you to attach another smaller pack, such as this Rush 12 medical pack, to the actual front of it using the Rush tier system from 511. It's like a little $25 attachment from Amazon that I got that allows you to use the bags in conjunction. A super neat attachment that I've chosen to take advantage of, and hopefully it'll serve me well. So we'll go into my first aid pack here. So like I said, this is the Rush 12 from 511. Starting from the front to back, I'll move this out of the way. So I have my kind of a cell tag, so I can identify EMS. I work EMS on the civilian side as well when I'm out of school, and so I use this pack as well for that. So kind of a glow tape for identification, my PPE for gloves. All you EMTs know why that's important. I have my Leatherman Raptors here. These are really neat. These allow for, well, they're trauma shears, but they also have a bunch of different attachments for it. So I have that attached to my front for easy access. On the front here, I have my main trauma module. It's a little over the top, but rather have it and not need it than vice versa. So pretty much a stop the bleed kit with NPAs and some other things for treating shock and whatnot. Recently, our group just finished the Wilderness EMT section of our training before we head over to Malawi. Great training. I'd highly recommend it. And with that training, we learned a lot about how to use initial trauma supplies. With that, we have our Wilderness EMT kind of handbook. It's extremely comprehensive, goes over medical, environmental, and trauma modules, and kind of reminds us of all our training for it. So, got our handbook here. Moving to the more center pouch, we have our SOAP note. If you ever take a WEMT class, you'll learn why these are so vital and so important. So I keep a couple of these. These are actually made from Right in the Rain. Extremely versatile. If you know anything about Right in the Rain, the company, they make some amazing pieces of kit. So I have a few SOAP notes along with that. And then just my cardiac arrest procedures for my job back home for EMS. Going in the more center pouch here, I have my diagnostic tools. Diagnostic tools being like a BP cuff, stethoscope, pulse oximeter, a few chem lights here just for visibility's sake, and then just some basic over-the-counter medications. This is like antidiarrheals, acetaminophen, ibuprofen, antihistamines, antacids, and aspirin. I have 2 of these packs. More for myself, but if the team needs it as well, I have that on hand. So very handy pack. There are some things omitted from here. I do have a collapsible BVM as well that I'll be bringing. That's extremely helpful. And then another kind of identification tab or tag. And then in the back, I don't know if you can see it, have a SAM splint with some Coban and wrap, as well as some oral rehydration salts for myself, the team, and those who are our patients if they need it. And that's just from Sarah Light. So that's kind of my med pack, how I have it set up. Like I said, there's a few things that are missing. We will put that to the side and move over to my main pack. Move this over here. Oh. So this is the Rush 100 from 511, like I said before. 60 liter pack with 3.5 liter side pouches on the side there. We'll start from the top. So at the very top of this pack, there's kind of a mesh pouch for any media devices that have lenses. I just have a pair of Gator sunglasses in here that I'm keeping. One of my favorite things that are in my kit here is this dry bag. I'll be placing all my important documents in here, yellow card, passport, wallet, anything like that. If it can't get wet, I have that just in a small little bag. This one's from Cry Precision. It's extremely light, it's waterproof, windproof, and everything you can think of proof. So one of my favorite things I'll be bringing is this. That should be it. There's a few things that I don't have in there, like I said before. Just initial name tape, just for identification. We'll be traveling a lot, so it's easy to identify your luggage and make sure it gets to you. This is one of my favorite things as well. This is from Thyrm, T-H-Y-R-M. It's pretty much a battery case that is sealed off from the elements. So it's waterproof battery case. You can put 4 AAAs in here. This is just extremely helpful and useful part of my bag. On the front's another 511 pouch. This one's more for my portable battery, just for my phone, any other miscellaneous things for my computer, iPad, phone. It's also water resistant on this pouch. I haven't figured out what I want to put on the very front portion, but we'll kind of figure that out later. In case we need to do any search and rescue work or any work with ropes, I have some Petzl gloves here that are just attached via carabiner. Within this main pouch, this is more of a general purpose kind of section. I have some EMS notes from another Right in the Rain product. Just measures vitals, statistics, and some patient care documentation on it. Kind of some snack pouches on the side. I plan on having some more electrolytes in this pouch. And then there's a secret little pouch in the back. Super neat. That's going to house my life straw and my field mess kit. And not pictured here is a collapsible cup for water as well. Super neat mess kit. Has a spork and a knife in it. So that's what I keep on the very, very back. Kind of moving down, we went over this in the gloves. This is my main sleep system compartment. It's made to house a regular size sleeping bag. Because it's Malawi and it's super hot, I don't really need a full-size sleeping bag that's rated for the cold. For that reason, I have this small jungle bag from Snug Pack. It's coyote brown. It's treated with some antimicrobial properties to keep the bugs away. It has a mosquito net as well built into this tent. Before we go, we spraying all our stuff with permethrin and some other products containing DEET just to keep the insects and bugs away while we're over there. So super neat piece of kit that I'm bringing here. This is my Whoopie. It's called a Whoopie. If you've spent any time in the military, you know how important and valuable this thing is. So that's why I'm bringing one. It's super comfortable and it packs down to a super small size. And then not pictured, I'll have a pillow from Nemo. It's their Philo, not sure how to say it. Elite pillow. It packs down super small. I'll have that as well in there. And then on the very bottom, this is from Thermarest. It's their Z-Lite sleeping pack. It's super comfortable. I took it on our response to Florida for the Fort Myers response. It was super comfortable. So that's that. And then last but not least, we'll go over the side pouches. So like I said, these are the 3.5 liter side pouches. I'm most likely just keeping them for sustainment. So this is my food and snack pouch. I have a bunch of Cliff Bars, beef jerky, whatnot in there. And then on the other side, I'll have water. So this is just my main electrolyte. It'll house my 3 water bottles as well. And then I forgot to mention as well, my Camelback system. Looks like a normal Camelback system, but due to the fact that in Malawi some of the water is not like it is in the States anyway, as far as sanitation, I was able to acquire a product from LifeStraw that connects to your bladder and acts kind of as a go-between between your bladder and your actual hose. This is from LifeStraw, about 40 bucks, and it's good for, it'll be good for my whole 3-month trip. So that just connects to my main water 3-liter bladder from Camelback, as well as my main hose. That's pretty much everything. There's a few things, like I said, that are coming in the mail still that I have to kind of pack. Thanks for sticking with me and staying till the end of the video. If you have any advice on how I can maybe set this up better, any recommendations, please leave them in the comments below. As always, please like, comment, and subscribe, and we'll see you on the next one. Thanks.